Hello, my name is Tyler. Today we're going to be initiating IV therapy. Basically, I'm going to collect all my supplies that I'm going to start my IV site with. I have an IV start kit. I have my tubing. In this case, I do not have normal tubing in my bag. I do have Y tubing. We're just going to have to pretend, and we'll just say that this hasn't been opened. I've already used both my catheters for practice. This catheter does have a lid on it. I'm not going to recap my needle. We're just going to pretend that this is closed. I've already taken the blue part out. Unfortunately, it got ruined the first time I stuck this banana and the second time with my other kit. So, okay, basically now that I've got all my supplies, I'm going to come in. I'm going to assess the patient, ask them how they're doing, double check that I have the right patient. We're going to go over the MAR. I'm going to see if they have any allergies. We're going to go over the reason for therapy, why the provider has ordered it, go over if there's any reason that they cannot have it. If they've ordered 2 solutions, we're going to go over the compatibilities. I'm going to double check that there's no interaction with any of the medications. In this case, I'm just doing normal saline, starting an IV, so nothing to really worry about there. I've got my 250 ml bag of normal saline, or 500 mLs, whatever. Got my banana patient here. So I've gone over any reasons that the patient can't get this IV site. I've checked their dominant arm. They've let me know that they want it in their left arm. Their right arm is moving a lot. They have no upcoming surgery scheduled, but I've gone over my 6 rights. I've triple checked everything. I've triple checked my drug. I've got all my supplies here before I start therapy. Patient's okay with it. We've talked about any concerns. Okay, so basically I'm going to wash my hands. I'm going to perform hand hygiene, get a pair of clean gloves. Going to go ahead, I'm going to prep my little extension tubing here with my normal saline. We're going to pretend like this is a 10 ml normal saline. Going to take off the cap. Going to be really careful not to touch any of this. I have my, going to go ahead, I'm going to take off this cap. We're going to connect so that this is ready to go in. Over here, we're going to connect this to the catheter site. We're going to flush it. I'm just going to prime this, make sure that there's no air bubbles, make sure that the saline doesn't have an air bubble in it anymore. Then I'm going to put the piece of this back into here, just to keep it clean, maintain cleanliness. We don't want to contaminate everything that's going to be connected to the catheter that's going into the patient. At this point, I'm going to apply a tourniquet. This tourniquet came in the kit, but we're just going to, for sake, say that I'm applying it. We're gonna prep it with an easy release on the patient, because at this point we're just palpating for a vein. We're looking for a good vein in a good spot. Some people do it on the hand, some people do it in a brachial. We're going to do it up here. I'm going to double check that they have a pulse in that arm, which is good, they do. Seems good, just so I kind of have a baseline. And then what we're going to do is, now that we found our vein, patients pump their fist, we can feel it, we can see it. That's perfect. I'm gonna go ahead, I'm gonna put on sterile gloves. I don't have any gloves at this point, and I do apologize for that. That's my fault. I kind of trashed them because I've been using this kit over and over and over to make these videos, and I keep forgetting things. So basically, the first thing that you're gonna do at this point is we're going to clean the patient's site. This is ChloraPrep. Some kits come with alcohol, some come with iodine or betadine. Just double check the allergies. If they have any allergies, be aware of that. ChloraPrep, in this case, no allergies, perfect. We're gonna clean around the site, around a big area around the site for quite some time. Make sure it's good and clean. We're gonna let it air dry. We're not going to be blowing on it or waving it or anything like that. We're just gonna let it air dry. Okay, patient's site is clean. We have our extension tubing prepped with our normal saline. Gonna open it for a catheter. This catheter, unfortunately I've already used it. We can go ahead, we can pop this off. This would usually have the blue piece of rubber in it. I've used that. we're gonna get the patient ready. We're gonna let them know there's gonna be a stick, you know, go in, bevel up along the line, or excuse me, along the vein. You're gonna go in. Once we go in and see a blood return, we're not gonna push this catheter all the way in. What we are gonna do is we're gonna push it just a little bit further. We're gonna take this blue part that's on here. We're pretending that there's a blue part, this part. We're going to push this blue part in. We're gonna advance the blue part. I hope you can see. I'm sure you can. We're gonna advance the blue part and we're going to pull this catheter back. Okay, so the blue part's in their skin. While I do this, I'm occluding the vein. So once again, this is in. We're not inserting this catheter all the way in. This blue part is on here. We're going to be pushing on the blue part. We're not gonna be touching this part, the threaded part, because that's what's going into the patient's skin. So we're just gonna go ahead, we're gonna push this off with our thumb, insert this, pull this out. I'm occluding the vein. Okay, that's done. So while I have this, I'm gonna get my tape. Well, my tape should have already been ready, but okay, so I've got my tape. I'm just gonna say my tape was here. Got my vein, I'm occluding it. I'm anchoring the IV site. Got my tape. I'm just gonna go ahead and tape this piece down. I've had quite the time with this today. Tape this piece down. You're not gonna put it over the site, you're just gonna tape the plastic part. Usually, once that's in, you can get another piece of tape and you can lattice it around, kind of in an X, so that it's anchored up here. Okay, we're just gonna pretend I did that because okay, so once that's in, we can go ahead, we can connect this. We're gonna take off this cap, take our little extension tubing cap off. We are going to go ahead, we're gonna screw it in here. Okay, we're gonna pull this back just a tiny bit to make sure we're still in the vein, and we're gonna flush. When we flush, we're looking for any kind of blanching going on, okay? We're looking for puffing or blanching, and we're just gonna double check with the patient. Does that feel okay, or does it hurt? The patient's gonna say, no, it doesn't hurt, or yes, it burns. If it burns, it's probably in the tissue, which is not a good thing. We're gonna just go ahead and restart the site altogether. But in this case, it's flushing properly. We're going to go ahead, we're gonna just tape this, anchor it. Or excuse me, we're gonna put the Tegaderm on first. And then we're going to anchor it. Okay, we've got that. Since we've already, I can't remember if I primed and spiked this in this video, but I would have this ready. This is my normal saline, it's up here. I'm going to take off the cap to my tubing. Make sure that the distal portion here that's gonna screw right into this catheter extension kit is clean. It's still got the cap. We don't want it dangling everywhere. But what I'm gonna go ahead and do is I'm gonna take off this cap, hang this up, or excuse me, hang this up, take off this cap. We're gonna go ahead, we're gonna spike our bag. Okay. The roller clamp should be closed. If not, it's okay, because we're gonna prime this anyways. We're gonna make sure that there's no air bubbles. We've checked the bag of saline for integrity. The bag looks good. There's nothing odd about it. The expiration's good, right drug, all that. So now we're over here. We've got this spiked. We're going to go ahead, we're gonna squeeze this little portion. I know that this isn't the right tubing and you can't really squeeze this, but we're gonna squeeze this till it's about 1/3 to half full, until it starts dripping. Because then we're just gonna open the roller clamp. We're gonna prime this right into the garbage. We're just looking for some droplets so that there's no air in the tubing. Now that that's ready, where is it? I've got this. I'm gonna unscrew my normal saline. I've flushed the site. Site looks good. I'm gonna unscrew this, clean it with some alcohol, an alcohol swab. I'm gonna take off this cap and we're just gonna go ahead, screw that in, okay? Then I'm gonna double check the drip, or if it's going through a pump, but in this case, it's gonna be gravity. I'm gonna double check what I've set it to, the drip rate. I'm just gonna double check that it's flowing. I'm gonna ask the patient, are you okay? Patient's gonna tell me, yes, I'm okay. I'm gonna go ahead, I'm gonna document how the patient tolerated it, what arm I put the IV site in. I'm gonna make sure that my IV site is labeled with this little IV site, or we're just gonna go ahead, we're gonna loop it around the tubing here so that people know what gauge needle I put in, my initials, the date, all that. When I do go back to chart, I'm probably gonna stay in the room just for a few minutes, make sure that the patient doesn't have any kind of reaction, and just be on my computer. I'll chart the arm, or the place I gave, or I initiated it in. In this case, we're gonna do left arm. And we're gonna document the rate of the flow that I have set it up with, how the IV site is flushing, any signs of reaction. I'm gonna go over with my patient. I'm just gonna tell them, hey, if you do feel any different, if you feel bad, if you get short of breath, if you get lightheaded, dizzy, you know, if you see redness, if it itches, if it hurts, if it, you know, we're gonna go over what to look for in adverse reactions. Patient's gonna tell me, okay, they understand. I'm gonna make sure that they have their call light. I am going to, if I'm just leaving my shift, obviously I'm gonna put this in a report that I've initiated IV therapy, and the oncoming nurse is gonna have a good idea of what it is, what to look for, what the drug is, how long it should run, you know, all that good stuff. But basically, I'm going to be coming in to check on the patient semi-often, at least once an hour, depending on facility protocol. Usually it's like 1 to 2 hours, but we're just going to make sure that the patient's safe because that's our main goal here. I do apologize. I used all my supplies in this video multiple times, and I kept forgetting steps. Hopefully I didn't forget any steps in this video. But we're just gonna thank Mr. Banana. Mr. Banana's been good. We're gonna clean up everything. We're gonna wash our hands and complete the day. Thank you.